from your mouth to your child. So if you are doing any of these things, you can pass not only illnesses, but also the germs that cause cavities to your child. So you want to avoid licking or cleaning your child's spoon or pacifier with your mouth, blowing on their food, taking a bite or tasting your child's food, or of course, sharing a toothbrush. We recommend that everyone in the household has their own toothbrush. You also want to avoid sharing cups and utensils. So now we're moving more into the eating and drinking choices that can affect your overall health and your dental health. So cut back on high sugar and refined foods. We think of only candy when we think about foods that cause cavities, but it's really all of these things that have carbohydrates in them. So that includes chips, cookies, crackers, dried fruits, anything that can stick to your teeth. So a lot of times parents will say that they don't give their child candy, so they're having a hard time understanding why they're giving cavities, but maybe they're giving their child dried raisins or some other type of food, goldfish crackers during snack times, and those foods stick to the teeth as well. And if they're not being cleaned out properly, then they can lead to cavities just like candy does. You also want to be aware that it's important to limit how often you're snacking. So children, especially that like to kind of graze on snacks throughout the day, are causing more acid attacks to happen in their mouth. And so you want to kind of limit them to have a snack just a couple of times a day and make sure that you're having them drink lots of water or brushing their teeth. So eat more fruits and veggies. That's definitely our goal. These processed foods do have a lot of hidden sugars, and the natural versions of the whole fruits and veggies are the best option. So our focus also for today is cutting back on sugary drinks. So these include drinks like sodas, sports drinks, energy drinks, juice, and flavored milk. Even 100% fruit juice does have a great amount of sugar in it, as well as acid. And it's always best to have your child just drink regular milk versus adding chocolate flavoring or strawberry flavoring, as that combines it with added sugar. So as you can see here, a typical 20-ounce soda or juice or fruit drink contains 15 to 18 teaspoons of sugar, which is as much as 3 chocolate candy bars. So of course you wouldn't eat 17 packets of sugar, so we wouldn't want you to drink them either. Drinking sugary drinks makes more acid, which can cause cavities. And even diet sugar-free sodas, although they don't have the same type of sugar, do still contain acid, which can harm your teeth. So we definitely recommend to drink more water. This part right here was taken from a great website called Rethink Your Drink, and they have some really great resources for parents to look at. There's a sugary drink calculator that you can put in the information from what you usually consume on a daily basis, and it provides some great examples of how you can swap out those drinks to decrease the sugar that you're taking in. So this gives some examples of some regular drinks that are commonly found, for children and toddlers, and how much sugar that they contain. So keep in mind that 4 grams of sugar is equal to 1 teaspoon. So that's also the equivalent of 1 packet of sugar. So a lot of those common things have quite a bit of sugar. Just the citrus soda alone has 19 teaspoons of sugar. Water, of course, has 0 teaspoons of sugar and 0 calories. So this also shows what the recommended daily limit is for newborns and infants. It's 0 teaspoons of sugar is what's recommended. Toddlers and preschools, 3 to 4 teaspoons, and children's 4 to 8, 4 to 5 teaspoons. So those are really going to be our focus because that's when they're learning those early habits, and we can prevent a lot of these things from getting into their diet. So, sugar sweetened beverages, or SSBs as they're referred to sometimes, are leading sources of added sugars in the American diet. So, this information was taken from the Colgate website that ranks 12 drinks that are the best and worst for your teeth. So, sparkling water is a new kind of alternative, and there is some debate about whether or not carbonated water is bad for your teeth. Usually it doesn't have a lot of sugar, but it can be acidic or have some added sugar if it has additional fruit flavorings. So it's still good to kind of limit how much you're drinking the sparkling water or having your child drink that. Some new phases are also drinks like kombucha or vinegar-based drinks, and those do have quite a bit of acid in them. And so that can also lead to enamel erosion and some cavities and issues as well. Another drink that's not so much for kids, but as we talked about before, adults have to take care of our teeth as well, so we can be a good example for our children and not pass any of the bacteria from our mouth to theirs. Coffee is also another drink that can wear down the enamel, which can cause sensitivity, some staining. And if you're going to add sugar to it, of course, that's another issue. So it's better to either skip the sugar or do a sugar alternative substitute. Sweet tea is another drink that we don't also think of as a culprit of causing cavities, but it can cause staining as well. And if you're drinking it with regular sugar, it has the same effect as a soda would. And so it's better to use that sugar substitute or limit how much you're drinking throughout the day. All right, so then these are also some, oops, I'm sorry, I skipped over one. So this is an example of what you should be looking for when you're purchasing drinks or food items for your family. Sugar has many different names. So when you read the labels, you definitely want to look for any of these names here on the screen: glucose, molasses, sugar, high fructose corn syrup. Even if it has honey in it, you have to be aware of the added sugar in honey. So these are some little tips also that you can keep in mind, that it's always best to choose water or milk. And keep in mind that milk does have natural sugars. So 1% or non-fat is what's recommended for children that are older than 2. And keep those healthier drink options handy. So keep a cold jug of water in the fridge or bottles of water. And you can do some things to zest up the water by adding fresh fruit or cucumbers, and always water down any 100% fruit juice that you provide for your children. So you can do that either by just adding a splash of the juice to water or by freezing the fruit juice in an ice cube tray and then just adding that to a glass of water so that they're not getting that full concentration of the sugar in the juice. So ultimately, you want to reduce the number and portion size of sugary drinks and only drink them once in a while. 8 ounces or less is what's recommended. So these small changes definitely reduce the oral health problems. Like we talked about, substituting sugar sweetened beverages with other healthier options, rinsing with water after you do drink sugar sweetened beverages. Using a straw will help limit the exposure of the sweet beverages on your teeth. And you do want to avoid frequent sipping of the drink. So if you buy a big gulp that's 45 ounces, you definitely don't want to have that with you throughout the day. It's best if you're going to have a sugary drink to consume it all at once, and that way your mouth is not constantly being bathed in that sugar. So every time you take a sip, just keep in mind that you're re-exposing your teeth to a 20-minute acid attack. Other things that we can do is to use fluoride toothpaste that helps to strengthen the tooth enamel and reduce cavities. And there's a way that you can calculate the amount of sugar in your drinks by using this formula here below. You look at the ingredients on your drink and keep in mind that the grams of sugar on the drink, you divide that by 4, and that equals the teaspoons of sugar. But you also want to keep in mind how many servings that are shown on that label. Sometimes that one drink is actually 2 servings, and so you actually have to times that by 2. So it increases the amount of sugar that you're looking at. So we're also considering not only the effects of these sugary drinks and the overall sugar in your diet on your teeth, but also your overall health. So as we can see here, oops, I'm sorry. I keep pushing the button to go back. So as you can see here, sugary drinks increase the chance of becoming overweight or obese. So an 8-ounce sugary drink a year, one a day for a year, is equal to 55,000 calories or 15 pounds a year. And drinking one 12-ounce can of pop each day increases a child's chances of becoming obese by 60%. So these are added concerns that we have for not only ourselves, but for our children. Sugary drinks increase the risk of developing type 2 diabetes. So people who drink 1 or 2 cans of soda a day have a 26% greater risk of developing type 2 diabetes. Not only does it cause type 2 diabetes, obesity, weight gain, but there are also other complications like heart disease, kidney diseases, non-alcoholic liver disease, and then, of course, what we've been talking about today, the tooth decay and cavities. But also, we've seen some cases of gout and arthritis. So that's all taken from the CDC website about the statistics on sugar sweetened beverages. You also want to think about how it would take 56 minutes of brisk walking at 3.5 miles per hour to burn off the calories of just one 20-ounce soda that is 258 calories and contains 15 teaspoons of sugar. So one easy thing that we recommend is that instead of providing your child with juice, it's always better to eat your fruit whole. So even if it's 100% fruit juice, it's going to have a lot more sugar in it than if a child were to just eat the apple whole or grapes. And so you want to take that into consideration. So these are the recommendations from the American Academy of Pediatric Dentistry for juice consumption for children. So they recommend no juice for children younger than 6 months of age, only 4 to 6 ounces daily for children ages 1 to 6 years old, 8 to 12 ounces for children 7 and older. And fruit juice offers no nutritional benefit to children under age 1 and should not be included in their diet. The other thing that we want to keep in mind, like we mentioned before, is that anything other than milk or water should never go into a sippy cup or a bottle. So all of this is important because our mouths are constantly going through what we call a plaque attack. And that means that there are 20 billion bacteria in your mouth that reproduce every 5 hours. So if you go without brushing for 24 hours, that turns into 100 billion. So a plaque attack is constantly happening in our mouths. So we want to do everything that we can to reduce the amount of sugar that's sticking onto that plaque. So those same teeth, after we've put this pink disclosing solution, it shows all of that plaque that's staying behind on our teeth. So we definitely want to make sure to encourage everyone in your family not to rush when you brush. Make sure that they're getting all the different parts of the teeth clean when they are brushing twice a day. That's why we recommend the 2 minutes to make sure that they're doing a really thorough job. And it's great to use either a brushing timer. Some toothbrushes have timers built into them. Sometimes people use a song on their phone or the radio to kind of keep track of the time. So those are all kind of fun things that you can do to make sure that you and your family are brushing for the right amount of time. So what causes tooth decay? We have a simplified kind of formula here for what happens when you're developing a cavity. So first we start off with that bacteria in our mouths from the plaque that's constantly growing. When we add sugar to that, it produces an acid. And once that acid goes onto our normal healthy tooth enamel, it develops a hole on the tooth decay. And so that's what we're trying to avoid by doing everything that we can for prevention. So it's important to see the different stages of cavities because tooth decay is preventable. That's why we want parents looking at their children's teeth early on to know what to look for when you see the beginning stages of cavities. So on the right-hand side, you see normal, healthy teeth and gums that look um, smooth, shiny. The gums are nice and pink and healthy. In the next picture, you see chalky white spots. Usually those first occur right along the gum line, and that's usually the most common places for people to miss while they're brushing. So those are the beginning stages of cavities and something that you have to be aware of so that you know where you need to brush better and what to look for when you go talk to the dentist. You can make them aware of those spots that you're seeing. We want to avoid those white spots from turning into the brown spots. That's usually an indication that it is a cavity that may not be able to be reversed and probably has to be fixed with some type of filling or dental treatment. Sometimes when we have those white chalky spots or an early sign of a cavity, we can do some things at the dental office to keep the cavity from growing bigger or to stop it from changing into a cavity that does need treatment. So down at the bottom, we see severe decay. And unfortunately, we see this in children at a very, very young age, sometimes even at 1 or 2 years old. And usually when the teeth have gotten to this point, they may need to be extracted. And when teeth are taken out before they normally would fall out on their own at around 5 or 6 years old and older, that does cause the problems that we talked about before with speech development and needing severe dental treatment. That's more invasive. Another thing besides cavities that we want to talk about is how acid erosion affects your teeth. So when your teeth are exposed to acid in different substances like these sugar sweetened beverages, it temporarily softens your teeth, causing some damage. So your saliva does help to neutralize the acid, which is why you need to limit how many acidic drinks that you have, because the more that you have, your teeth are exposed to the acid over a prolonged period of time, and it can cause more damage before your saliva can neutralize it on its own. We also recommend that you wait 30 minutes before brushing after you have acidic drinks because you don't want to spread that acid around and the enamel on your tooth is softened at that point in time. So what we recommend is that right after having something acidic, instead you drink water or chew a sugar-free gum that will help to stimulate the saliva that neutralizes the acid. So another important thing that we talked about is regular dental visits. Our whole goal is for prevention of cavities and oral health problems and overall health problems. So going to your dentist every 6 months or as recommended by your dental professional is really important so that you can catch things early on, talk about what you're doing at home and what your diet has in it so that your dentist can make suggestions for you. And we encourage you to make these visits fun for your kids. So during your visit, your child or you will have your teeth cleaned, an oral health exam will be completed, and potentially they'll take some x-rays or pictures of the teeth that will show us areas that we can't see just by looking in the mouth. And of course, we do recommend that you find a good dental home so that you feel comfortable going to this dentist regularly for any concerns that you have, and they will be able to answer your questions and make you feel comfortable about the treatment that they're completing for you. So you want to talk to your dental professional about your whole mouth. That includes the teeth, the gums, your lips, your tongue. Anything out of the ordinary is what they're looking for when they check your mouth. And they're going to talk to you about any dental treatment that is needed and explain that a little bit more. Some of the things that we recommend in the dental office to help prevent cavities are fluoride and sealants. So these are things that will help protect your teeth in addition to brushing and flossing from the acid that's in your diet and the sugar that's in your diet. So the fluoride makes our teeth stronger and it can slow or reverse the white spots that we talked about earlier, or early signs of decay on the teeth. So, your dental provider may apply fluoride directly onto your teeth during your dental visit, and it's a protective coating that's just painted on. Um, Usually, people use a fluoride varnish at this point in time. We don't see as much of the use of the fluoride foam or gel. So, usually, they're using a fluoride varnish like you see in the picture and just easily painting that on the teeth. Now, the fluoride varnish does work best when we apply it 3 to 4 times a year. So, if there's an opportunity at your child's school or at a health fair for them to get a fluoride varnish treatment, it's a good idea to help make their teeth stronger and healthier. And just keep in mind that it is something that's safe and fast, easy for your child to do. Another way to get the fluoride is by drinking fluoridated water. So, depending on your water source, if you have city water that or community water that's fluoridated, it's usually safe to drink because they've added just the right amount of fluoride to help to prevent cavities. But it is good that if you aren't on city water, if you have a well, that you do have your water tested to see how much fluoride is in your water. And then, of course, we do recommend using toothpaste with fluoride as soon as the first tooth appears, because that's another great way that you can get that fluoride on the teeth. And then after your child brushes, you don't have to have them rinse with water. You can just have them spit out the extra toothpaste. That way the fluoride stays on their teeth and you don't rinse it off after brushing. So sealants are the other cavities prevention method that also help to protect your teeth from that acid and sugar. So sealants block out the food and bacteria from a tooth's natural pits and grooves. So you see in this picture here, one of the molars or the back teeth that has really deep grooves where all of that food can get stuck. And then the tooth on the right has a plastic sealant that fills in those grooves and makes the tooth surface smooth. So this is another picture that shows that those deep grooves can actually be a problem because their toothbrush can't get into those deep grooves to remove the bacteria. So that's why this sealant is so important. And usually we apply the sealants once your child has permanent molars, but sometimes your dental provider may recommend putting sealants even on baby teeth because sometimes those grooves are really deep and more prone to cavities. So now we're at a point for some questions. So I want to thank everybody for joining today and taking the time and the commitment to keeping your family healthy by taking care of their oral health and their overall health. So I think I did see some questions in the chat. Do you want to tell me what the questions are, Dawn, or do you want me to look
Yes, I
at
can
those?
pull up some of the questions we've seen in the chat. We have some amazing representations from different areas in the US. But someone did ask if any way we can get a copy of these slides. The images are great for patient education.
Oh, great. Yes, I wouldn't mind sharing the slides. In fact, if you wanted to send them out, or I do have let me go to the next slide. This next slide has my contact information, my email address, and my work cell phone number. So if you're interested in the slides, you're welcome to email me and I'd be happy to send those to you.
Thank you, Ellie. Also, I had a question and I was curious about. So you said that, you would take consideration of adults drinking a 20-ounce bottle of soda. It could take about 56 minutes of a walk to walk those calories off. You would think that would be even, I guess, harder for someone that's maybe older to do, and that would probably affect their health a lot more because maybe they're disabled or have trouble walking. What would you consider for them to, I guess, to do to kind of get them calories off if they decided, hey, I want a soda today?
Right. Yes, that's definitely something to keep in mind because, of course, children are going to burn those calories at a different rate than adults, or like you mentioned, adults that maybe have some disabilities or some problems with doing strenuous exercise. So, I guess you can kind of keep in mind to be active throughout the day, taking more kind of short walks throughout the day. That way it'll kind of break up the amount of time that you have to spend doing it all at once. And, maybe doing some more exercises while seated are still a good option as well if you're not able to do a brisk walk. So just kind of alternating different activities that you can do based on your abilities.
Thank you for that. And we do have a couple questions in our chat questions box. First one is, do you have any brands of children's toothpaste with fluoride you recommend?
Well, there are so many options out there, and I know that, fluoride is still a little bit of a controversial topic. So, you do have some parents that opt for a toothpaste without fluoride, but when you think about it, that's really just kind of giving the brushing flavoring, making it a little bubbly. So, it's not really giving any benefit to the teeth to use the toothpaste without the fluoride. So, I mean, any toothpaste that has the ADA seal of approval is what I would recommend. And then, of course, just making sure that you're using the recommended amount of toothpaste, because if you're just using a small smear of toothpaste, like the size of a piece of rice or smaller, then your child won't be swallowing enough that it'll be any problem for them. So they're just swallowing just that small amount, which is safe.
Thank you for that, Holly. And then another question that was in the chat, does anyone know of a free or low-cost resource to get well water fluoride tests? I cannot say that right. Resource to get well water fluoride testing.
I think if you reach out to your city water treatment facility, they'll be able to provide you with some information on how you can get your water tested.
And then Miranda Davis did post in the chat that she has a link that she shared for water testing kits that are for fluoride. Some states will mail you a testing kit, but she's not sure if those will test for fluoride, but she did share a link for that. So thank you, Miranda, for that.
Yes,
Um,
thank you, Miranda, for providing that.
yeah, that's really great information. And we have another question in the Q&A box. We cannot drink city tap water due to lead and high trihalothiamines. We must drink only bottled. So is there a bottled water brand that contains fluoride?
Yes, that's a great question. I know that is a concern for many communities that can't drink tap water for different reasons. So they do have what's called nursery water, and that has fluoride in it. So you can usually find that at the grocery store. You can even find it online in like a gallon jug, and that's bottled water that does contain fluoride.
And then someone posted in the chat, we also use the Rethink Your Drink. Each year we switch up the drinks and put the amount of sugar in each drink in a Ziploc bag next to the drink. It's a really good visual for the patients. I've seen that done before, and I think it is, I see people walk by like, oh my gosh, I didn't realize my Pepsi had that much sugar in it.
Yes, definitely. Seeing that visual does have a big impact because once you see how much sugar is in that little Ziploc bag in the drink, that really does make you think about what you should do as an alternative.
I was curious too, when considering things like I guess drink alter or nutrition alternatives for youth that have trouble, like maybe need to have food therapy, and they drink. those children's protein drinks or the children's nutrition drinks? Or do you have any idea about how much sugar are in those drinks?
That I'm not sure, but I know that they probably do have a pretty high sugar content in them. So those would definitely, it would be important to look at the labels and the serving size for those. And make sure that you're definitely keeping up with the oral hygiene if that's something that has to be a part of their regular diet.
Thank you for that answer. Yeah, I was curious about that, and I know some people are unaware of to checking those labels, and sometimes those labels can be a little confusing to read. So if you think of like one sugar packet you see at a restaurant or somewhere that you put in your drink, that's probably about how much is, you would think that's many packs what Ali was mentioning is in certain amount of drinks. So if you see like 20 grams, it's probably about 20 of those packets.
And those drinks are kind of like a thicker consistency, so they do kind of stay on the teeth and kind of um, bathe your teeth in that sugar probably a little bit longer than if it was like a different type of drink that isn't as thick and sugary.
Do we have any more questions anybody would like to have answered or just any comments they would like to say for the presentation? Oh, we did have someone mention another thing to consider is children's vitamins. Make sure they are brushing after they take those, especially at night.
Yes, definitely. They have the sweet vitamins for kids, and then even now for adults, they have the gummy vitamins, and those really do stick to the teeth. So that's a great idea is to be aware of that and make sure that you're having your child brush afterwards.
And we have some comments saying you had a great presentation today. Again, really thank you for doing this presentation with us. And then also, oh, someone did say thank you for the answer on bottled nursery water. How many per day is safe, recommended to drink?
Is that about the nursery water?
Yeah, I believe so. It says on bottled nursery water.
I think that that should be fine as far as if you're giving your child like the recommended amount of regular water, because if there it has the right amount of fluoride in there, the parts per million that's recommended, as far as like what it would be in community fluoridated water as well. So if they're drinking like the 8 ounces or 12 ounces a day, that's perfectly fine. It probably has the recommended amount on the label as well. So just to be on the safe side, I just recommend making sure that you check that because I don't have that information specifically depending on what brand you get.
And someone asked 8 to 12 ounces a day, but I am an elder.
Adults would be able to drink, more than that. So, but I would just still recommend reading those labels.
And what would you consider for someone that, I guess how someone, if maybe they're visually impaired, what would be a good method for them to know um, how to get information with these labels?
I believe that I don't know for sure, but I believe that there's a way that you can contact the manufacturers to get the information. Um, I don't know what the best resource would be to find out how to go about that, but I'm sure that there's a way that you can get the information um, that it's either uh, something that you can listen to, like if you call the number of the manufacturer, they may be able to have that listed for you. I'm not really sure. But that's a great question. I'll have to look into that.
Yeah, we had someone mention there are apps available for grocery shopping for visually impaired as well. Thank you for that information.
Yes, thank you.
And I did put your email in the chat, so if anybody has any other questions that need, answering, please email Ali. I'll also put my email in the chat as well. Um, we have some good resources for all the information you need for your children and for those that you take care of. There's some really great things for children, especially those that maybe that are special needs. And we know some, if your child or person that you're taking care of maybe have some special needs and there's some difficulty getting teeth brushed or anything, please reach out to us, any one of us, and then we will direct you to those resources. Um, Southern Plains Tribal Health Board team has some really great resources for you too as well. But we want to thank each and every one of you for coming out onto our webinar today. We will be having some more later in the future, so just keep posted on those and we'll be sending notices out for those. We'll be having some hopefully in the next month and then throughout the year through the Southern Plains Tribal Health Board. But we wish each and every one of you a blessed and very great week. And then if you need any assistance with anything, please reach out to us and then we will get back with you. But I will be sharing a link of this webinar too for the recording in our emails that you put in for your registration. And then someone said, thank you, just happened to see the flyer at my Osage Health Clinic. So thank you, Cheryl, for that. And thank you for joining us today. I appreciate all of you guys again for coming out and joining us today. And again, thank you. And thank you, Allie, for taking time out of your busy schedule to join us. I really appreciate it.
My pleasure. Thank you all for having me, and please reach out if you have any other questions. Thank you for your time.